The next speaker is Dr. Suber Wang. Suber and I know each other for 30 years. We went to medical school together. Suber is the Searle Professor of Ophthalmology at Case Western in Cleveland, and this is his first time at Hawaii Retina. So welcome, Suber.
Thanks so much, and again, thank you to the program committee for inviting me this year and to share some thoughts this morning on ocular trauma. This is a particularly different talk for this particular section. We're actually not going to talk so much about surgical techniques, but to give you briefly a sort of potpourri of the issues that come up with ocular trauma. Ocular trauma is actually, most of the series published in the literature now are occurring abroad, and essentially that shows the frame shift of our thinking in terms of epidemiology and public health in the United States, both with regard to eye safety as well as overall understanding and better surgical techniques. One area, though, is growing, and I'm going to end with those comments, and that's about battlefield injuries, which unfortunately we are a world leader in its investigation. These are my financial disclosures. I have no conflicting financial interest in this presentation. Ocular trauma can be put into several categories as a clinician. One of them is the diagnosis. Sometimes it's really not that hard. Elias went out yesterday and had a fruitless day of fishing, but
and that's not me either.
And he says that fly fishing is dangerous, particularly because of this kind of thing. This is a nice treble hook from bass fishing. However, there are other times when it's a management dilemma. So if you have a patient such as shaken baby syndrome here, there's a lot of issues that go along with that, and that's yet another category of trauma